Go ahead.
All right, so now I'm going to be showing you a muscle energy technique for an anterior fibular head. And so since this is muscle energy, it's a direct and active treatment. So what I'm going to do is first find the fibular head, and I'm going to have my index finger and middle finger posteriorly and thumb anteriorly. And an anterior fibular head would be able to move anteriorly but not posteriorly. So what we're going to do for this is use an acronym that helps me, AIDER, AIDER for anterior, inversion, dorsiflexion, and external rotation. So that motion barrier, that restrictive barrier is going to be posteriorly, so you're going to be pushing the fibular head posteromedially into its barrier. And so you're going to, again, invert, dorsiflex, and externally rotate that tibia. And you're going to ask your patient to evert and plantar flex, and you can do that by asking them to push their big toe towards the floor for 3 to 5 seconds against resistance, and then relax. And you have 2 to 3 seconds of post-isometric relaxation, during which you're again going to invert, dorsiflex, externally rotate, and try to slide that fibular head a little bit more posteriorly into its new feather's edge restrictive barrier. And again, you're going to ask the patient to evert and plantar flex by pushing their big toe towards the floor for 3 to 5 seconds and relax for 2 to 3 seconds of post-isometric relaxation, after which you're again going to invert, dorsiflex, and externally rotate, trying to push that fibular head posteromedially into its new restrictive barrier, and ask the patient to again evert and plantar flex by pushing their big toe towards the floor for 3 to 5 seconds, then relax for 2 to 3 seconds of post-isometric relaxation, bring it into its last barrier there, and then bring back to neutral. And again, you could do this more than 3 times if you felt it was necessary. And then you would check again to see if that fibular head could move a little bit easier posteriorly as well as anteriorly. And your fibular head does move a little bit better. And you would also reassess that bilaterally to compare.